Hello scholars, my name is Dr. Karis Dillon, and the goal of this channel is to make academic subjects easier to understand. In the last video, we looked at developmental coordination disorder, and in this video, we're going to look at stereotypic movement disorder. So let's begin. When a person is diagnosed with stereotypic movement disorder, this means they have repetitive, driven, and purposeless motor behavior, such as shaking of one's hands. If you hit your own body, you might bite yourself, maybe you bang your head, you poke your eyes, your body rocks. And this movement can interfere with your social life, your academic life, and your occupational life, which can cause injury or self-injury to the person who is having this repetitive motor behavior. Now, this disorder tends to be diagnosed during the early developmental period when the child is very young. And the repetitive behavior is not because of physiological effects of a substance. It's not because of a neurological condition. It's not because of trichotillomania or obsessive compulsive disorder. It is just present. It is there. And it tends to come about in childhood. So when you are diagnosing stereotypic movement disorder, you need to specify if there is self-injury to the individual or if there is non-self-injury, if it's a repetitive behavior that can cause damage to the person. You also want to specify if it's associated with a medical condition or a neurological condition or an environmental factor. So if it does, you want to code this along with that, meaning the number system. You want to code this along with that neurological or that medical or environmental condition. You also want to specify if it's mild, moderate, or severe. So if it's mild, then the child can sometimes suppress that repetitive behavior. If it's moderate, they might need some protective measures so that they don't injure themselves. And if it's severe, you want to put a plan in action and make sure that the child or individual is being monitored on a regular basis so that they don't injure themselves in any way. Now, as a clinician, you'll want to write down the frequency of this stereotypic movement disorder and record how much you see it, but how much the parent describes seeing it, or the child themselves, if they're able to communicate that with you, and talk about its severity. The movement has to be purposeless for it to be stereotypic movement disorder, which means there's no rhyme or reason for it. The movements may or may not be responsive to efforts to stop them. And sometimes when the child is young, if you focus on that movement or you focus on bringing attention to it, it can actually help to stop it. If there is a neurological condition, though, that accompanies it, this will be a lot tougher to stop. When an individual knows that they have this disorder and they're conscious enough to deal with it, sometimes they will try to restrain their own behavior. So they may, if they flap their hands or their fingers, they may attempt to sit on their hands or to wrap their hands in their clothing or do something so that they don't have that movement. Each person kind of has their own pattern of behavior. So, it can range from face slapping to head banging, fingers fluttering or flicking of the fingers. They might bite their lip or their tongue. They may push a part of their body, but it's a continuous kind of repetitive movement. And the amount of times that they do this can be very different too. It can last anywhere from seconds to minutes. It just kind of depends upon the pattern of that person. So it can happen many times a day, or a person can go many days without having this come about. But individuals will tend to have bigger periods where they're doing this repetitive movement if they're stressed out, if they're fatigued, or if they're bored, or if they're excited. So stereotypic movement will typically begin with the first 3 years of life. 80% of cases happen before 2 years old, and these eventually usually get resolved over time, or they're suppressed in some way. But those individuals that have lower cognitive ability tend to be at a greater risk for carrying on these pattern behaviors, and they tend to have a poorer response to that intervention. This does occur all the way across different cultures, different races. It's interesting that it comes up in childhood most of the time. And it's very, very common for this disorder to come along with other medical conditions or other neurological conditions. Now, this disorder has been seen in infancy, and it has been seen in children that are younger than 3, which is very intriguing. A majority of the time, though, you'll see it correspond with some type of other medical or neurological disorder. So some of these other neurological or medical disorders that it tends to come along with is autism spectrum disorder. It can come along with tic disorder. It can also come along with obsessive compulsive or related disorders or other neurological conditions. So this is definitely a disorder that tends to be more comorbid. The biggest concern with this disorder is definitely the self-injury, and that's where putting a plan in place that the parent or the caregiver knows about or the educator knows about. You'll tend to see this a lot with autism spectrum disorder. They want to make sure that there is no self-injury happening. Sometimes these repetitive behaviors are a means of kind of blocking out the world or too much sensory information. But putting that plan into place, making sure that child is safe or that individual is safe, is of the utmost importance with this. Okay, so that is the end of the video. I hope that you liked it, and if you did, please click on that like button and don't forget to subscribe. I'm hoping to get more of these out this week. I know many of you are studying for tests for becoming counselors or psychologists, so I hope that these help. Send me a message if they do, and I will talk with you soon. Thank you very much.